want you to introduce yourself to us and to our listeners, just who you are. Tell us about you.
Absolutely. So right now I'm in Berkeley, California. I'm in the Bay Area, and I have a fun little prop here. This is from our clinic. This is a giant ear. I don't think I've ever seen an ear quite as big as that. So a little bit about me is that I grew up on the East Coast, and then I went to my audiology doctorate program in San Francisco. I was the first year, the first cohort of the new San Francisco University of Pacific audiology program. And one of the major benefits of being in a new program is that the curriculum was designed very progressive, very forward thinking, based on the 2015 trends and what's going to happen in the future. So how that ended up really benefiting me was that I realized over time that my biggest interest, my biggest niche specialty passion was with tinnitus management, particularly involved with the psychological nature of it, as well as the holistic health side of it. So fortunately, in our program, our administrators in our school decided that we were going to have a ton of tinnitus education. So we had 20 weeks of a 3-hour lecture of tinnitus. Wow. And it was 2 semesters, a weekly course, and it was taught by Troy Kasha, who's an audiologist and the leading clinical tinnitus specialist at UCSF, University of California, San Francisco Medical Center in San Francisco. I felt like one of the most engaged students, and I loved what Troy was sharing because although it was from a textbook, it wasn't a classical textbook experience because everything was related back to, these are what people say, these are people's real problems. This is what the textbook says, but let me share how it really goes. And that was very impactful for me. I ended up doing my residency, my 4th year. For us, it was a 3-year program. I ended up doing my residency externship at UCSF to take a deeper dive into tinnitus management. So that's a little bit about me. And I have a story to share about what sparked my further interest in taking my passion for tinnitus into a business model. So I'll share that when the time is right.
Yeah, no, that's awesome. You know, it seems like it's really kind of cool, but you did walk into this online community and what you're doing. So go ahead and explain what Pure Tinnitus is all about.
Absolutely. Pure Tinnitus was designed to be a hub, a center for educational resources for anyone in the global tinnitus community who wants some direction. In my experience, looking online, there's some misinformation. There's a lot of fear online about being stuck with tinnitus forever. And there are some great resources, but there's also a lot of not so great resources. So let me take a step back. When I was at the residency program in San Francisco, about halfway through in the winter, I was scheduled for a 90-minute tinnitus consultation. And I had a patient come to see me. I was their provider. And I saw when I was reading through their chart notes, preparing for the appointment, that they were coming from Lake Tahoe. And if anyone's familiar with California, Lake Tahoe is in the Sierra Nevada mountain range and San Francisco is by the coast. So that's a 4-hour drive. So they scheduled an appointment from Lake Tahoe and they drove 4 hours to see a tinnitus specialist. In the appointment, they're sitting down and they finally make it. And I confirm, so is it true that you drove from Lake Tahoe for this appointment? And they say, yeah, it's true. I went to my primary doctor. I went to an ear, nose, throat clinic there. They gave me some info. They told me I had some slight hearing loss, and they didn't really give me direction. And I was left with this place of, I know there's something more I can do. And that knowledge, that intuition led that patient to go on the internet and search for tinnitus services, California, San Francisco. They found the acclaimed UCSF program. They scheduled an appointment. During our appointment, we went through the tinnitus retraining model. That's what I was trained in. And the transition from the appointment into the next steps would be some guidance, some clarity, some things they can do on their own, some potential other resources, the cognitive behavioral or mindfulness psychological component, and how that all comes together. And for those of us who have been in the position of the provider, we know that's a big shift for someone to then have an understanding of the science and some options, some next steps of what they can do. So after that appointment, I had this realization of, okay, so now I knew I had a passion for tinnitus care. And I also knew, being in the Bay Area, I was really inspired by the innovation and the technology, the digital nomad lifestyle, internet jobs, working in tech. And I had this realization that if I'm going to create an online business or some offering through my audiology degree, it will be through tinnitus, because if someone's willing to drive 4 hours to see a specialist, then the demand is much bigger than I anticipated.
Mm-hmm. And I think that that's great too, because like you said, I mean, they spent time surfing the internet. And so what they're looking at is, I don't even know what the ratio is to what's out there that is incorrect versus what they really need to know. And so if you've got providers telling them one way, if you've got them searching blindly on the internet, I think that having something out there that has the correct information, where they can stumble across it is huge for them, right? And so I think that's really important to get out there.